Hello and welcome. My name is Raj Persaud. I'm a consultant psychiatrist based in private practice, working in Harley Street, London, in the United Kingdom. And I'm delighted to be joined today by Ruth. Ruth is a lady who experienced an episode of depression quite a while ago. Then almost a decade later, despite having a full recovery from her first episode, she got depressed again. But this time, things took a turn for the worse. So Ruth, can you tell us a bit about your experience of this second episode of depression and what happened?
Yes, I'd had a severe trauma in my life, which caused a lot of anxiety and stress. I think I'd been starting to get depressed before this trauma really hit home. And as it developed, I got worse and worse in my depression. This happened as it continued for a period of 2 years. I got worse and worse.
And what sort of treatment were you getting?
Well, various treatments. To start with, it was felt that I should have medication, so I was given medication. I was also offered counselling linked to the traumas I'd been experiencing in a relationship. And it really wasn't having any effect. I was so anxious. I was actually having experience of psychotic illness, which I had had in the previous experience of depression 10 years before. I was feeling that I was causing bad things to be happening, and I was in a very severely agitated state.
So when you say you were having psychotic experiences and you felt that you were the causal agency in things happening, could you say a bit more about that? Give us some examples.
Yeah, it was quite severe. I was feeling that I was causing bad things to happen, like world events. It was advised that I and my family shouldn't watch the news, for example, because if there were bad things on the news, I was feeling that I was in some way involved, causing things to happen. I had a belief that I was causing the grass not to grow, leaves on trees not to appear, that I had some kind of power over these natural world events.
But these were all negative events. Any bad thing that happened, like an earthquake on another side of the planet, you would be thinking that you were the cause, but it was always bad things. Is that right?
Yes, it was. Yes, yeah.
Tell us a bit more about the symptoms of the depression. So you had these terrible negative beliefs, or some people might call them delusions. But what other symptoms did you have? Did you lose your appetite? Did you stop eating? Did you lose weight? Were you having trouble sleeping at night?
Yes, I had all the classic symptoms of moderate to severe depression, I would say. I was getting to sleep at night, but I was waking very early, probably 3 a.m, and not able to get back to sleep. My mind was overworking. I was in a loop. I was constantly overthinking things, dwelling on events, dwelling on small issues. I did lose weight. Whenever I get stressed, I actually start to lose weight, and I did lose my appetite. And I was losing the ability to look after myself properly. So I wouldn't wear a variety of clothes. I was sort of wearing the same thing every day. I wasn't able to have conversations with people. I certainly didn't instigate conversation. I was very much led around, doing things. And as time went on, this happened more and more. And it was only through living in close proximity to the rest of my immediate family that I was able to really stay in my own home and exist.
So were you seeing a doctor or a psychiatrist for treatment of this problem?
Yes, initially I was under my GP and for the first sort of stages of medication. And as time went on, I was then referred to a consultant psychiatrist. That psychiatrist actually was working with me with some community psychiatric nursing care as well. So I was given intensive support. And then I seemed to get better to a degree. I got better for a while. I didn't get much better. My family didn't feel I really was very much better at all, but there was some sort of feeling that I was able to live without the need for this intensive support. So I was actually put back in the care of my GP. However, I felt I had a need to start working again. I hadn't worked for 18 months, and I felt it was important that I should start working. I had done a little bit of voluntary work, but I was very much in a daze, and I was still very agitated. I did start some work, and it went very badly wrong very quickly, and it completely set me back to the point that I then needed intensive support again. And under a different consultant psychiatrist, I was seen very regularly.
And eventually the idea of you having electro-convulsive therapy, or ECT, or what is referred to as shock therapy sometimes, must have been brought up in the conversation. How did that happen? How did it get discussed?
Well, it had got to a point after nearly 2 years of me being severely ill, and I was in a state where I was really almost like a toddler again. I wasn't self-motivated to do anything. I was really having to be guided. My family were incredibly patient, but they were also extremely stressed at this point, and they were clutching at straws. They were thinking, what can we do? What can be done? And it was actually my sister who researched ECT at this stage. It hadn't been suggested by any medical support at that point. She went online, she looked at the NICE guidelines for ECT treatment, and she was also aware that my grandmother many years ago in the 1950s and early 60s had ECT treatment herself. So there is a family history of its use. But obviously that was a while ago. My sister was interested to find out about the situation these days. Obviously there's differing opinions about it. And so she researched online, and she also found a TED talk given by Sherwin Newland in 2007. And this gave her some real hope, because Sherwin was explaining that he had got to the point where no treatment, no medication and no counselling therapy had helped him. So he seemed to be in the same position as me. And my sister felt at that point that here was a possible treatment that maybe could help me, where they really were thinking nothing actually was going to help me other than trying this. So she broached it with my consultant psychiatrist.
And then what happened?
Well, he wasn't sure to start with. He had some concerns. He obviously gave me and my family clear information about ECT treatment, and obviously explained that there are well-documented side effects, particularly of memory loss, that could be short or long-term. He wanted to make me fully aware. But it was at this point that my community psychiatric nurse said that she had experience in her previous employment in a different part of the country, where she had seen some really good results with ECT treatment, and she felt quite confident for me that it was an option to try. And I think that was encouraging, and that gave us all the idea that it was a good thing to go forward for it.
So then what happened? Tell me what the experience of receiving ECT was like.
Right. Well, first of all, I had to undergo some medical checks to make sure that I was a suitable candidate for the ECT treatment. To be honest, I don't remember a lot about that, because this is a period which is very hazy in my mind. I think mostly because I was so severely depressed. I was almost in a catatonic state, like a zombie, that I don't think things were even registering. So I can't really look back and remember clearly that period, but I can remember fairly distinctly that I then I personally had to agree to each session of ECT, and I asked a number of questions myself. I remember asking how many sessions might I need, what is the chance of me losing some memory, and I was told that probably I would have 2 treatments a week. Maybe up to about 6 or 8 treatments would be the typical norm. And so I agreed. And I think in a way I said, well, if my family think it's a good thing, then I'll go along with it. I was being very, led in how I was living at that stage. So I went to a very local hospital, luckily. I didn't have to travel a long distance, which was very fortunate. Originally, there had been some thought that I would travel quite a long distance each session, but I was taken on by a hospital which is very close. So I had a very short journey. Each session, I was greeted by a very nice, pleasant nurse, sat in a waiting room for a while, was taken into a pre-room before the ECT room, where each session I was asked, I had my blood pressure taken, I was asked a series of questions, sort of memory questions, and I had to consent, and then I was taken to the ECT room where I just lay down, had an injection placed in my hand, which really didn't hurt, an oxygen mask placed over my mouth, and I just slipped into a sleep. And the next thing I knew, each time I was in a recovery area, gradually waking up, which took a little while. And then I would go for a cup of tea, piece of toast, and sit with my family member who came with me each time before being driven home.
So some people might be surprised to hear that you really had this as an outpatient. You weren't an inpatient in the hospital.
Yes, I think I really was. I wasn't an inpatient because I was so fortunate in having a number of family members, my sister, and part of the time my brother, who actually lived with me part of the time, and my parents who were on hand to support me as well. They were really my caregivers, and if I hadn't had them, then I would definitely have been in hospital. It had almost got to the point where they actually were reaching the point at which they couldn't care for me much longer before I had the ECT treatment, but they were still caring for me.
Okay, so the kind of Hollywood portrayal of ECT is often portrayed, as in films like One Flew Over the Cuckoo's Nest, as a very sort of horrific experience, which is painful and distressing. You're giving a very different description.
Yes, I mean, I appreciate that some people may have had different experience, but I can honestly say from my point of view, there was nothing in the experience that was frightening. The anaesthetist and my consultant, my ECT consultant, were the same person pretty much every time. Certainly my ECT consultant, I think it was only a couple of sessions when I didn't have the same ECT consultant. And he was a very positive person, always very supportive and upbeat. And I think that really helped me to feel confident about the process each time. Okay.
But basically what you're kind of saying is you didn't feel any untoward effects at all.
No. After the first couple of treatments, I would go home with I think the first treatment, it's fair to say I had a headache. After a couple more treatments, I had a minor headache, but after that, and a period of a few hours of a little bit of disorientation. And I would tend certainly to have a rest. And after the first few treatments, I definitely had a sleep. I would sleep for a couple of hours. But as time went on and I got more used to the treatment, then I didn't really need the same level of sleep, actually. It took a day out in a way, because it was certainly all morning. And then in the afternoon, I would just sort of in any way, I was still in my depressed state for most of the time for the time I was having ECT. So I wasn't really doing a great deal anyway. I was in quite a sort of very low motivational state anyway. But
basically, you were under an anaesthetic throughout the time you were having it, so you didn't feel anything.
No, nothing at all. No.
Sorry, I interrupted you. You were going to say something else.
No, as you say, I don't remember, but as you say, I was under anaesthetic, and I believe I was given a muscle relaxant each time as well. So I didn't bite my lips or have any sort of tense muscles or anything, which is, I think, how it's portrayed still in some of the media, that, there is a lot of concern about that.
So after you had the course of ECT, I mean, how many ECTs did you get, and how soon after that before you began to recover from your depression?
Right. I initially had, and I had bilateral ECT rather than unilateral, so that's on both sides of my head. I had about 16 sessions, so a number of weeks, twice a week. before there was really a great deal of change. And at that point, my family and my consultant psychiatrist were saying, well, we're not sure about going on with this. There doesn't seem to be a great deal of improvement. My anxiety certainly had diminished. That happened quite soon. There was an obvious change there, but I still had no motivation. I had no interest in doing anything, no empathy with people, no conversation still. But my ECT consultant was prepared to carry on, and he was quite encouraging and said, I would just like to try for a bit longer. He had the thought that a little bit more could actually be what I needed. And I think he hadn't been giving me a very high dose either. So, that possibly was a factor in this. And then I ended up having 23 sessions. And there was quite a marked change between 17 and 23. And really, by the time I finished ECT, my family was seeing quite a dramatic change in my personality, in my outlook, and how I was engaging again in conversations. I was starting to look to do things. And it was only a period of about 8 weeks after that I really felt I was coming back to becoming myself again after this period of over 2 years. By then, 2.5 years of being completely unlike my normal self.
So you made a complete recovery, and you would attribute that to the ECT?
Yes, I think that was the only thing that managed to make a difference to this severe depression I was in. And I think I talked subsequently with my ECT consultant when I had got better, about 5 or 6 months later. Obviously, my consultant was interested to know about the effects, the after effects, and how I felt. And I said, I'd like to discuss the fact that I am so much better. When he saw me, as have lots of people, he said, I hadn't appreciated just how ill you were, really, knowing you now as you are, compared to how you were when you presented. In a strange way, I could still function. I could still, go through the motions of things, but I just wasn't at all like my normal self. People who have met me now again since say, you are so different. And I say, well, I am back to how I should be. This is me. This is the real me now. And I attribute it to having the ECT treatment.
Speaking as a psychiatrist, I would say that there's a fair amount of skill that was deployed in your treatment, in that you had quite a lot of ECT by some people's standards.
Yes.
And some people would have given up much earlier, after maybe 8 sessions or maybe 16, if it hadn't worked by then. So the fact that you had a skilled psychiatrist who persisted, I think, who obviously knows a lot more about ECT than I do, but that seems to have been a factor. If you hadn't had that skill at your disposal, you may have had a different outcome. Also, the choice of bilateral ECT as opposed to unilateral ECT and the dose as well. These are all factors where a skilled psychiatrist is in play in terms of determining the outcome. Any thoughts about that?
I totally agree. I think I was very fortunate in the psychiatrists that worked with me. Very, very fortunate. I also attribute some of the relaxed feeling I have about the ECT to the personality of my psychiatrist, in a sense. The fact that he was upbeat and was very engaged, with helping me. And put my fears at rest each time. I'm sure, and the nurses as well. I feel all contributed. I had a good experience. I realise some people don't have such a good experience, but I do think that all really helped me.
So, what about people's reaction today? Because you seem to be someone who's comfortable discussing the fact that you had ECT. When you tell people that you've had it, what's the kind of reaction that you get? Are people surprised? Are people appalled that you had it because they're really antagonistic to ECT?
No, in the main, and I've been very open and clear and honest with people, because I think, in a sense, if there's something good got to come out of my experience, then I want to be able to share. It's been interesting. A number of people, and I'm just under 50, there's been a number of people of my sort of age group that I've associated with who've said, I know of somebody who's had ECT, or, I've come across far more people than I thought I would, who, when I talk about it, have a connection somewhere with ECT. So that's been interesting. I've had very few people who have recoiled in horror. I've had a few people who have not really understood what it. Well, quite a few who've had to actually explain what it is. That they have no understanding, and there are people. I've been surprised. I've had to explain what the process was, what ECT stands for, what it means. So that's been interesting. But in the main, I haven't had that many people who've been sort of horror struck by it.
One of the other issues is that the extent or the depth to the depression that you had is important. A lot of people think of depression as being mildly upset. I mean, the extent to which you got depressed, felt like a pretty serious, disabling, incapacitating physical illness almost. I don't know what your thoughts are about that.
Yes. In many respects, I believed I was actually dead. So, there is this sort of feeling of lack of emotion to the point where I actually used to say to people, I'm not actually alive, I'm dead, I've died. I had no emotional responses, and which is, quite a scary thing to be in that feeling. And certainly it had effects on my health. I physically looked different. My skin was affected. I stooped. I was extremely tense. I couldn't write properly. I had extremely tiny writing where I was so tense when I was trying to write. I wasn't able to process things properly. So a lot of effects. It wasn't just I feel blue, I feel miserable. It's far more encompassing than that. It's severe depression.
Would you say that you actually believed you were dead? There's a famous delusion called Cotard's delusion in psychiatry, where people who are very depressed believe they are dead. Did it go as far as that? You actually thought you really were dead, or yes, you felt as if you were dead?
No, I felt I was dead. I said I've died. I used to say I've killed myself. I don't know how I had achieved that, but I believed that I had gone into a state of being dead. And I used to say to my family, "You'll realise soon this terrible thing that's happened that I'm actually dead."
So that's a really horrible experience.
Yes, yeah.
So would you say that in your case, ECT has been life-saving?
Absolutely. To me, it was a miracle cure. I dread to think where I would have continued to be without this. It's like a jolt, it was something, okay, it was over a period of 11 weeks, but it seemed to jolt me back into life. And I have embraced, since then, I've absolutely embraced life again. I've been as active as I've ever been in my life. Extremely happy, extremely busy. I took it gradually. Everyone was stressing to me as I got better, not to leap into things, to take care and to do things gradually, which I did. I was very mindful of that. But I completed treatment at the end of May last year, and by November I was back working not in a pressurized job, but in an interesting job, several days a week. By January this year, I was working full time, and I'm pursuing that again. As time goes on this year, I'm working full time still.
So one final question, and thank you very much indeed for talking to us. But if someone is listening to this who's feeling very depressed and no treatment has worked, should they consider ECT?
Yes, I've already, I think, thought in my mind that even though there is, I haven't actually mentioned, and perhaps I should, that I have had some memory loss. Certainly as I got better, I forgot things like passwords for my computer, how to actually use my computer. But I do have to factor in that I was so ill that I was not really doing these kinds of things anyway. So I was relearning things because I hadn't done them for such a long time, and because I was in such a state of not really thinking and doing things properly. But there is a whole year really where there are things I just do not remember. I don't remember going off on holidays that I went on. I don't remember watching films that I've seen subsequently and been told I've seen before, but I have absolutely no recollection. there are people I meet that I apparently know, I recognise their face, but I've had to say to them, excuse me, I've not been well. I know I recognise you, but I don't know where from. And that's worked out fine. That's been okay. I say this because that is obviously a major concern for a lot of people about considering ECT. But I would trade that. And to be honest, people have said, well, what that year that wasn't, that you had memory loss, it wasn't a great year anyway, was it? And really, is it better that you actually had that memory loss but got better than that you remained in such a bad state? And I would say if medication or counselling or combination haven't worked and somebody is thinking, what could I possibly do? Then I would definitely say ECT is worth exploring.
Ruth, thank you very much indeed for talking to us.
Thank you.